Good afternoon, everyone. We now proceed with the new topic sa introduction sa visual diagnosis. Okay? Inspection is the very first assessment used when the initial patient practitioner contact occurs. This process continues through the diagnostic processes, the way in which a patient answers questions or responds is an important aspect of her spirit, as are the actual answers that diagnostic interactions may provide. First is the definition. Inspection is an examination method which employs the practitioner's visual sense to observe abnormal changes in the patient's spirit, complexion, body, tongue, secretions, and excreta in order to understand and predict pathological changes of the internal organs. So, importante alam po natin or ma-observe natin yung patient's spirit, complexion, body, tongue, secretions, and excreta. Okay? Next, we go to the fundamental theory of inspection. In the human body, internal organs and the exterior of the body are closely connected and related through the channels and collaterals and through the qi and blood. The face and tongue have especially close relationship with the zangfu organs because all channels and collaterals pass through or connect to the tongue and face. Okay, so makikita natin po siya sa tongue and face. In addition, all 5 zang organs open to an orifice in the head. Excreta and secreted substances are produced by activities of the internal organs. As such, they can manifest pathological changes of the internal organs. Therefore, through inspection of the external changes of the body, one can know the condition of the internal organs and understand their pathological changes. This process is described in the defined pivot, which states that observing the outside manifestations in order to understand the organ inside so as to identify the disease. So, kung ano po yung na-observe sa labas, this help us understand the condition inside ng patient. The clinical significance inspection allows one to assess the essence and qi, the state of the pathological change, transformation of the illness, prognosis, thermal nature of the pathogenic factor, state of anti-pathogenic qi, and the zangfu organs involved. Next, the scope of inspection. The inspection includes 5 major areas. First is the inspection of the whole body, which includes inspection of the spirit, facial complexion, and body appearance. Second, inspection of local areas, which include the head, face, 5 sense organs, body, skin, and extremities. Third is the inspection of the infant's index finger. And the fourth is inspection of the excreta and secretions. Fifth is the inspection of the tongue, which includes inspection of the tongue body and its coating. Okay? Visual diagnosis is something that people constantly utilize without necessarily being aware of it. What you must learn as a practitioner is to refine this ability. When someone who is angry or distressed enters a room, you are usually in no doubt about their mood. Similarly, if a person is exhausted or has a heavy cold, you will usually also pick up on this, both by seeing them and when talking to them. This is because there is a multitude of signs and signals, some more subtle than others, that we pick up on. We perceive and mentally record these signs without even thinking about it. What we as therapists must do is refine this ability to observe relevant signs and see them as part of the pathological pattern. Visual diagnosis in Chinese medicine has two prerequisites. You must learn what the different visual diagnostic signals are a manifestation of in a Chinese medical context, and you must train your observational skills, your visual attentiveness, okay? The former is a matter of understanding and remembering how changes in the body's internal physiology will manifest on the exterior of the body. The latter requires honing your visual awareness and focus so you are able to perceive these signals. Something that is also vital when utilizing visual diagnosis is good lighting. This is especially relevant when observing the complexion of the face and the tongue. A great many details can be overlooked because the lighting conditions are poor, or the signs can be misinterpreted because the light source causes the colors to have a different hue. So, what are the signs and symptoms that we will be looking for in this diagnostic pillar? Which signals from the body should be observed, and what is the diagnostic significance of these signs? In the moment a client steps through the door, we immediately start to form an impression of the person. We do this based on their body shape, their postures, their way of moving, the colors in their face, the complexion of their skins, the expression in their eyes, their body language, and how they sit down on the chair, and much more. During the diagnostic procedure, we actively observe specific areas of the body, including the tongue, the fingernails, and the skin. This is because certain aspects of the body manifest a lot of relevant information that can give us vital information about the patient, information that can often determine the diagnosis. Okay? In Chinese medicine visual diagnosis, this information is utilized in a structured manner. We consciously focus on and interpret the signals that are being radiated by the patient. We process the information and relate it to our understanding of the body's physiology. Within the first 3 to 4 minutes, we experience Chinese doctor may well have determined the fundamental aspect of the diagnosis. The rest of the consultation is then used to confirm and further refine the diagnosis. So, very important po yung visual diagnosis, and pag meron tayong ma-observe, i-confirm po natin dun sa other examinations that we could ask sa patient. Having said that, it does not mean that you should blindly adhere to their initial diagnostic impression or solely approach the diagnosis using intuition. At times, this becomes a difficult balancing act. We must learn to trust the first impression we have received. This is because this first impression can often be of great diagnostic importance, especially because it is in this moment that we are often most intuitive and least rational in our thought processes. However, we must simultaneously maintain a flexibility in our thinking and our approach to the patient. Our mind must not get stuck on a diagnosis and thereby become blind to the diagnostic signs pointing in other directions. We must be aware of the risk of interpreting symptoms and signs only from the perspective of our initial hunch. It's like being a detective. We must follow a lead but not get stuck trying to pin the evidence on our initial suspect. So, importante po na para tayong isang detective sa alam na kung ano po yung condition ng patient. Okay? Intuition without a theoretical foundation is nothing other than the guesswork. Intuition requires that you have a strong theoretical basis that you have some consciously utilized. So, importante po na even though we have an intuition about the patient condition, it should be supported with a strong theoretical basis. Most of us, at least to begin with, have to look systematically and consciously for each visual signs. We must consciously ask ourselves questions while we observe the patient. How is their facial complexion? How are their body movements? And how do they dress? And so on. Later on, you will begin to answer these questions subconsciously and just say to yourself when you see a client, liver stagnation and heart yin deficiency without having consciously thought about it. Okay? So parang nagiging automatic na if naging part na sa iyo yung usual pattern ng pag visual examination. Some diagnostic areas are more straightforward than others. Diagnosis of body movement is usually fairly straightforward and can be observed from a greater distance than, for example, the skin in the area around the eye. Several signs that have relevance must be consciously sought out. For example, skin lesions that are covered by clothing. They will first be seen only when the relevant area is uncovered. J.R. Worsley advised practitioners to set up their practices so that they can see their patients when they arrive in their car and walk towards the clinic. This means you will have time to see the client and their natural posture and body movements, etc., without the client being aware that they are being observed. Okay, so from the car, walking towards the clinic, nag-start na po yung pag-observe ng patient and nagpo-formulate na po tayo ng ating visual examination sa ating client. As stated, good lighting is crucial, important in visual diagnosis. You should, whenever possible, take advantage of daylight. Unfortunately, this is often not an option because there is a building just opposite your window that blocks the light, or your client has come in the early morning or evening. It is therefore a good idea to decide on what form of artificial lighting you will be using in the clinic and then investigate how this source of light affects the various color tones. Okay? So even though nagagamit po tayo ng artificial lighting, we should try and observe the effect of lights that we are using sa client. This can be done by initially observing the skin, tongue, and other aspects of the body in a natural daylight, then observe the same area when it is illuminated by artificial light source and mentally noting the difference. So dapat alam natin and ma-observe natin or ma-experiment natin ang difference with the use of daylight and then observing it with yung natural lighting or artificial lighting that we use in our clinic. Okay? Sa relative strengths of visual diagnosis, observation together with auditory diagnosis is the cornerstone of the intuitive approach to diagnosis. Through these two approaches, we can often determine a substantial part of the diagnosis. We must learn to trust this ability, but at the same time not confuse intuition with guessing. Okay? When observing the client, we are not dependent on the client's subjective interpretation and presentation of their diagnostic signs. So wag po tayong depend a lot sa mga sinasabi ng pasyente, and we should use our visual examination. Visual diagnosis is central in diagnosis of children. Relative weakness of visual diagnosis. Many of the visual signs are very subtle and thereby difficult to differentiate. So, kailangan po maging observant tayo kasi minsan hindi natin mapapansin and importante po na ma-know na makuha natin yung difference. There are almost too many signs which can be overwhelming, making it difficult to maintain an overview. So we should take note ng mga na-observe natin para hindi natin ma-miss kung overwhelming po yung na-observe natin na mga conditions. The facial signs can be concealed by makeup. So pwede rin makover ng makeup yung importante dapat na makita natin sa facial diagnosis. Okay? Sa diagnostic tips, remember to notice PTK and Nevi will while palpating and locating acupuncture points. Remember to notice whether the skin is dry while palpating and locating acupuncture points. So, while palpating and locating ng acupuncture points, so we use the observation sa skin and mga other changes in coloration. The skin that is red or ruddy is a sign that heat is present, at least in the local area. Skin that is purple is a sign of blood stagnation in the area, and discharges and exudations that are yellow or greenish are always a sign of heat. Okay? So thank you for your attention.